Hi, my name is Daniel Masserang, and I'll be the nurse practitioner student doing your physical assessment today. Can you start by telling me your name and date of birth?
My name is Alan Cunningham. My date of birth is August 25th, 1987.
Good. And any medical history?
No.
All right, I'm going to start by washing my hands. And then just looking at the patient, I noticed that he's well-groomed and his dress is appropriate, as well as the interactions. His mental status seems to be appropriate as well. I'm going to start by taking the patient's vital signs, his heart rate, respiratory rate, blood pressure, and temperature. Then I'm going to also calculate his BMI by taking his height and weight. As I'm doing these things, I'm going to be assessing his skin. I'm going to look for any lesions. His hair is symmetrical on both sides and evenly distributed. His skin is clean, warm, dry, and intact. I'm going to also inspect the scalp. There are no lesions and no evidence of infestation. Next, I'm going to look at the patient's face. His facial features are symmetrical. I'm going to palpate the scalp. Any tenderness?
No.
I'm going to palpate the patient's temporal pulses. They're both normal. I'm going to assess the patient's fifth cranial nerve by having him clench his teeth as I'm palpating the temporomandibular joint, and then move your jaw side to side. Good. I'm going to also assess your seventh cranial nerve by having you smile real big, raise your eyebrows, and puff out your cheeks. And for the sensory portion, I'm going to have you close your eyes, and I'm going to put both a dull and sharp object on your face, and you'll tell me which one it is.
Okay. Dull. Dull. And sharp.
Good. All right, now I'm going to assess your eyes. I'm going to have you read the Snellen chart by holding it an arm's length away and reading the lowest line possible.
Okay. FELOPZD.
And are you wearing any corrective lenses?
I am.
So the patient has 20/20 vision with corrective lenses. Next, I'm going to assess your peripheral vision. I'm going to have you cover your left eye. I'm going to wiggle my fingers, and you're going to tell me as soon as you can see them in your field of vision.
Okay. No. 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 No.
Good. And can you cover the other eye?
No. 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 No.
Okay, good. All right, next, I'm going to assess your third, fourth, and sixth cranial nerve by having you follow my finger through the 6 cardinal fields of gaze. All right, good. And now I'm going to inspect your pupils. Right, just look straight ahead. Right, pupils appear to be symmetric in size and approximately 3 millimeters. I'm going to use my pen light to get your pupils. Patient's pupils are equal, round, and reactive to light, with no evidence of nystagmus. Next, I'm going to look at your eyes and have you look up. Sclera are white and no evidence of jaundice and no tearing or drainage present. Now I'm going to use my ophthalmoscope to look at the structures of your eye. Maybe. There we go. All right. Patient's red reflexes are present bilaterally. Also, the patient's eyes. The arteries and veins appear to have good circulation. Next, I'm going to inspect your ears. The outer ear has no lesions Any tenderness?
No.
No tenderness at the mastoid process and tragus. What about over here?
No. Nothing.
No tenderness or pain at the mastoid process or tragus. Next, I'm going to test your 8th cranial nerve by doing the whisper test. So I'm going to have you move the tragus of your ear like this, just to make some sound in one ear. And then I'm going to whisper a sequence of numbers or letters, and you're going to repeat them back to me.
Okay.
All right, now I'm going to have you occlude your right ear.
P4-2.
Good. And then I'm going to have you move the tragus of the other ear a few times, and then occlude it for me.
C8-1.
Great. Patient's 8th cranial nerve is intact. Now I'm going to use this tuning fork to test for lateralization of sound in your ears. So I'm going to strike my tuning fork and place it on the crown of your head. You're going to tell me if you can hear the vibration more so in the right ear, the left ear, or equally in the middle.
I can hear that equally.
Good. Now I'm going to test air and bone conduction. I'm going to strike my tuning fork and then place it on your mastoid process. You're going to tell me when you can no longer hear it, and then I'm going to move it to outside of your ear, and you're going to tell me again when you can no longer hear it.
Okay.
So first we'll do the left ear.
No. No.
Okay, good. We'll do the same with the other ear.
No. No.
Good. Alrighty. So next, after testing that, I'm going to use my otoscope to look in your ears. I'm going to pull the pinna up and backwards, noting the bony prominence to the tympanic membrane. It's pearly gray with no bulging or erythema, and the cone of light is approximately at the 5 o'clock position. Now for the other side, I'm going to pull the pinna up and back. The patient has some mild earwax, but I can visualize the tympanic membrane. It's pearly gray as well, no bulging or erythema, and the cone of light is approximately at the 7 o'clock position. Alright, next for your nose, I'm going to have you occlude one nostril and breathe in and out.
Okay.
And then do so for the other side. Patient's nose is patent without any congestion. Now I'm going to have I'm going to look in your nose with my pen light. No polyps are visualized and no bleeding in any of the internal structures. And I'm just going to palpate your maxillary sinuses for tenderness. Any pain?
No.
In your frontal sinuses?
No.
All right. For your mouth, I'm going to, just looking at the patient, I can tell his lips are not excessively dry. I'm going to put on my gloves and use a tongue blade to look in the back of your throat. I can get these gloves on. Alright, and I'm going to use my light. You say, ah. Can you swallow? Good. Patient's 9th and 10th cranial nerve are intact. Patient's uvula is not red. Did you say one more time?
All
right. And no exudate or erythema at the back of the throat. Uvula was symmetrical. Just going to wash my hands again. Yeah, I'm just going to wash my hands again. And notice the tongue. Can you stick your tongue out for me? Move it side to side. Patient's 12th cranial nerve is also intact. No ulceration on the sides of the tongue as well. Now I'm going to inspect your neck. And then I'm going to test the range of motion for it. Can you move side to side like this? Good, up and down. And then touch your ear to your shoulder and the other way. And then can you do a circular clockwise motion and counterclockwise? Now I'm going to have you try and turn your head against my resistance, yeah. And then ear to shoulder again. Good, and one more. Patient has good strength of the neck as well. Now I'm going to palpate the patient's lymph nodes, cervical lymph nodes, starting with the preauricular, postauricular, occipital, submental, submandibular, tonsillar, anterior cervical, posterior cervical, and suprascapular. Good. Patient's lymph nodes were not hard, fixed, and no evidence of malignancy or infection. Next, I'm going to palpate the patient's thyroid. I'm going to feel the patient's thyroid cartilage and move down till I reach the first two rings of the trachea and have the patient swallow. And I'm just going to gently push the cartilage side to side. Cool. The patient's thyroid feels smooth with no evidence of a goiter or any nodules. Now I'm going to inspect the patient's upper extremities and shoulders. So I'm going to ask the patient to remove his shirt. Alright, so first I'm going to check the patient's axillary region lymph nodes. So to show you on the right side, if you can see, okay. I'm going to have you lift your arm up. Alright, so first the pectoral area, lymph nodes, central, brachial, and the subscapular. I'm going to do the same for the other side. Pectoral, central, brachial, subscapular. Good. Patient's lymph nodes are also not hard, fixed, and have no evidence of infection or malignancy. Now I'm just going to inspect the patient's shoulders and clavicles. They appear symmetric with no deviation. I'm going to look at the patient's sternoclavicular area, palpate it, acromioclavicular, and subacromial area. Good. Any pain or tenderness?
No.
No. Good. Okay, next I'm going to test your range of motion of your shoulders. I'm going to have you abduct them out and then put them back to place. And then I'm going to have you flex and extend by having you lift forward and up and then back behind your back. And then I'm going to have you rotate your shoulders inward and then rotate them outward. Okay, patient has full range of motion of his shoulders. I'm going to assess your 11th cranial nerve by having you push up against my resistance of your shoulders. Great. Patient's 11th cranial nerve is intact. Next, I'm going to inspect and palpate your elbows. I'm just going to look here. Patient's elbows are mildly dry, but the epitrochlear nodes are not tender. They're not tender, they're freely movable too. I'm also going to test the range of motion of your elbows. I'm going to have you flex and extend, and then rotate inward and outward. Good. Now I'm going to I'm going to test the strength of your upper extremities. I'm going to have you hold your arms out. Yep. And hand palms upward, sorry. And push up against my hands. Good. Push down. And push out. And push inward. Great. Patient has 5 out of 5 strength in the upper extremities. I'm also going to palpate your brachial pulse. Normal and 2 plus. And the radial pulse. Normal and 2 plus as well. Good. For the patient's anterior chest, I'm going to look at the pattern of breathing. I notice no retractions, no barrel chest. His diameter is 2 to 1, approximately, which is normal. And then I'm going to auscultate the patient's anterior chest. Well, first I'm going to auscultate the carotid arteries with the bell of my stethoscope. No bruise. No bruise heard. I'm going to palpate each carotid artery separately. Normal rate and rhythm. Normal rate and rhythm. Good. Okay, now I'm going to auscultate the heart sounds, the diaphragm. I'm going to start with the aortic. The pulmonic. The tricuspid. And then the mitral. I'm going to locate the patient's PMI by looking mid-clavicular line, palpating to the 5th intercostal space. I'm going to calculate the patient's heart rate. Patient's heart rate is at 60 in a normal rate and rhythm. I'm also going to listen for the patient's lung sounds as well. So I'm going to have you take a breath. 1 second. I'm going to have you take a breath. Alright, patient's lung sounds are clear throughout. I'm also going to listen to your posterior chest while I have my stethoscope. Can you take a deep breath? Okay, I'm going to assess for agophony by having you repeat the letters E, E, E each time my stethoscope touches your chest.
Okay. E, E, E. 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 E, E, E.
Okay, good. No agophony present. I'm going to assess for bronchophony now by having you repeat the number 99 each time my stethoscope touches your back.
Okay. 99. 99. 99. 99. 99. 99.
Okay, great. Now I'm going to palpate on the back of your chest to feel for tactile firmitus. And you're just going to say 99 again each time I touch the back.
99.
Can you scoot up a little in the chair? Like, move forward in the chair, sorry. Thank you.
99.
And one more time.
99.
Okay, no tactile firmitus heard. I'm also going to percuss the back of your chest in 6 different areas. Scoop her. Perfect, thank you. Good. Okay. So next for the abdomen, I'm going to actually have you lay on the bed. That way. Perfect. I'm going to inspect the patient's abdomen. Okay. I'm going to inspect the patient's abdomen. No striations noted. Patient's abdomen appears symmetric. No obvious herniations as well. Then before I percuss or palpate, I'm going to auscultate the patient's abdomen, starting in the lower right lower quadrant. I'm just going to pull your shorts out a little. Alright, the patient's bowel sounds are present and normoactive in all 4 quadrants. I'm also going to, while I have my stethoscope, I'm going to auscultate vascular sounds, starting with the abdominal aorta. Going to the left renal artery. Right renal artery. The right iliac artery. And the left iliac artery. No bruits are auscultated in any of the arteries. Next, I'm going to percuss all 4 quadrants of the patient's abdomen. Alright, patient's abdomen is resonant, and then I'm going to also percuss against the liver edge on the right side. I'm going to percuss for splenomegaly. First, I'm going to feel for the rib cage there. Alright. Now I'm going to lightly palpate the patient's abdomen. I'm going to palpate the patient lightly in all 4 quadrants. Let me know if there's any pain or tenderness. Any pain or tenderness? No. Okay, now I'm going to deeply palpate and let me know if anything bothers you. Okay. And then I'm going to just lift you up a little on this side for some bimanual palpation, as well as lift you up on the other side. Okay. Now I'm going to assess for rebound tenderness. I'm going to palpate pretty deeply and then let go quickly, and you're going to tell me if there's any tenderness.
No. No.
Okay, good. Alright, next I'm going to assess for the psoas sign. So this is a test that we can use to potentially see if there's signs of appendicitis. So I'm going to have you try and lift your right leg as I'm pushing down against your knee. And if there's any pain, let me know. Okay. And keep your legs straight, yeah. There we go. Any pain?
No.
No. So patient has a negative psoas sign. There's no pain in the right lower quadrant. Next, I'm going to assess for the obturator sign. So what I'm going to do is have you bend your leg, flex your leg, and then I'm going to rotate it inward and let me know if there's any pain.
No pain.
Okay, good. So negative obturator sign as well because the patient had no pain in the right lower quadrant. For the genitourinary assessment, most of it is going to be deferred, but what we can do is percuss the bladder, starting right below the umbilicus and then going down. I'm just going to have you lower your shorts to like just the waist. Yeah, there we go. And you're assessing for any dullness. Okay. And then next I'm going to have the patient just sit up, and I'm going to assess for CVA tenderness. So what, I'm going to have you sit up. And then what you do, I'm going to lightly palpate first and let me know if there's any pain.
No, no pain.
Serious. Alright, so next I'm just going to have a closed fist and I'm just going to kind of punch firmly and let me know if there's any pain.
No pain.
No pain? Good. Alright, so no CVA tenderness for this patient. I'm going to next assess your lower extremities. I'm actually going to have you come sit back in the chair. So first I'm going, well, maybe I can tilt this down. There we go. I'm going to assess the patient's hips. So I'm just going to feel the different anatomy of the hips. I'm going to feel for any edema, the iliac tubercle, the superior iliac spine, the greater trochanter, and the ischial tuberosity. Any tenderness or pain?
No.
No. Okay, next I'm going to assess your range of motion of the hips. I'm going to have you abduct your hips. You can do one at a time if you have to, but move them to the side.
Okay.
Good. And then move up, kick your leg forward, your hip up, bring your knee leg up. Yeah, perfect. And the other side. Okay. And then can you rotate your hip inward while you're sitting?
Yes.
Yeah. And then inward again for the other one. Perfect. This has full range of motion of his hips. I'm going to inspect your knees now. No deformity. The patient's knees are symmetrical. Any pain or tenderness here?
No.
No. Okay, good. I'm going to feel your popliteal pulses. 2 plus. The dorsalis pedis. 2 plus and symmetrical. And the posterior tibialis. You can also feel the femoral, but we're going to defer them right now. But the pulses at the lower extremities were 2 plus, normal strength, not bounding, and not weak. Next I'm going to inspect your ankles. No swelling noted, no redness noted, also no redness in the calves. I'm going to have you rotate your ankles for me to test some range of motion. Yep, and then flex and extend, move up and down, perfect. I'm going to have you push your feet down against my hands. Push up, push out, and push in. And then same with your legs here. Push out, push in, try and lift your legs up, and then hold against me. Awesome. Patient's lower extremity strength is 5 out of 5. Now I'm going to assess exteroceptive sensation. By doing that, I'm going to take an object. I'm going to have you close your eyes, and I'm going to touch 2 or 1 places on your lower extremities. You're going to tell me if I'm touching the left side, the right side, or both sides at the same time. So first,
Left,
and
right, both.
okay, awesome. All right, next I'm going to, real quick, I'm going to have you actually go back to the bed and lay down. I'm just going to test one more thing for your ACL. All right, I'm going to have you bend your knee. I'm going to fixate your foot. And then I'm just going to jerk your leg with pretty strong movement. Let me know if there's any pain. No?
No.
Okay. I'll do the same for the other side. Any pain?
No pain.
No. Okay. Awesome. So next, I'm going to have you go back to the chair. And I think we're done with laying on the bed for the rest of the time. Okay, now I'm going to test your deep tendon reflexes. Triceps. Good. And your biceps. Your biceps. Brachioradialis. Brachioradialis. Sorry, there we go. Patellar. Just relax. Good. Patellar. Make sure your Achilles. Your other Achilles. And then I'm going to assess your plantar reflex. Good. Patient's reflexes were all normal, with no Babinski reflex or plantar reflex noted, which is normal in the adult. And then next I'm going to have you identify, next I'm going to have you move your upper extremities in a rapid movement for me. Good. And then I'm going to have you keep your heel on the ground and tap your feet. So good rapid movement in the upper and lower extremities. Next I'm going to have you bring your heel to up your shin. Actually, I'm going to have you stand and do that. Yeah. Good. I'm going to have you walk heel to toe a little bit. Good. And then I'm going to have you close your eyes. I'm going to do the Romberg test. Keep your feet together and your arms at your sides.
Okay.
And then just stand there for a couple seconds. Okay, good. Patient does not have any instability and is able to stay balanced. Now I'm going to test pronator drift. I'm going to have you hold your arms out and close your eyes and try and keep them there. Good. Patient has no pronator drift as well. So now that completes my physical assessment, and thank you for watching. Thank you for watching. Okay.